Hi, I'm Wendy Phillips, and I'm going to be your preceptor for the Quality Management Rotation. We were asked to share a little bit about ourselves so that you can get to know us as we're going to get to know you during this program. So one of the first things that we're asked is to let you know how we first got interested in nutrition support. So I thought I would talk about the fact that I did my internship in Bakersfield, California with clinical rotations in several different hospitals. I couldn't take a clinical position immediately after graduating because, thankfully, my internship was funded by a public health agency, so I owed them 3 years afterwards working for them. So I needed to work as a per diem dietitian at the hospital, and the only patient population that didn't need to speak to me so I could go into work early before my full-time job was in the NICU. So I started out my clinical rotations, or my first clinical job was in a NICU. Still working at the public health agency, my second son was born, and he was actually preterm and admitted to a NICU at a different hospital. The dietitian there was one that I really respected. I knew her through the community, and she was very intelligent, and she came to me to ask me to make the recommendations for my son's TPN prescriptions. And I was really impressed by that. She admitted what she didn't know, and she came to get help. It also showed me how important it was to have the knowledge and then to share that with others. And it certainly showed me that I needed to be exactly right on my TPN prescriptions because it was my own son receiving that. I also wanted to share some professional projects that we have been working on. I'm very involved in public policy because I see the need to translate that quality bedside care that you all do into something that is relevant and understandable for public policy makers like our U.S. Congresspeople. Those national policies that are created then trickle back down to affect the bedside care. My expectations for you all of residents during my course is just to be open, be timely in your responses because you can expect that from me, ask questions when needed, and provide communication. And the most important thing that I'm hoping that you take away from this course is that you understand the role of quality management in your own job so that dietitians everywhere are responsible for quality management, not just the clinical nutrition managers in healthcare facilities. I'm also hoping you end up understanding the influence of continuous quality improvement results on the bigger picture of healthcare through public policy. All right, thank you everyone. Talk to you soon.